It's been brought to my attention that some of our colleagues aren't sure how to do a proper repair of a laceration that comes to the office or our ER clinics. So today we're just going to go through a quick demo, rematch, see if everybody's on the same page. If the patient's at home and they haven't come into the facility yet, or they just come in, they can't get in because we're jammed, you're going to want to apply pressure to the wound. Use clean gauze, clean cloth, plastic bag. Last resort, use a clean hand. You just want to get that bleeding to stop. If the blood comes through the clean gauze, don't remove it. Just keep applying gauze. Just leave it the way it goes. Elevate the wound above the heart if possible, because the blood flow cannot travel up. So just get that wound elevated. If the bleeding stops, you're going to want to clean the wound with just regular tap water until they get in here, and we'll get the sterile solution. If bone or muscle is exposed, don't try to push it back into place. You can do more damage than you can do good. Once the doctor is able to see the patient, it will be discussed if a surgeon's needed. Some of our lacerations that come through are going to be due to car accidents, knife wounds. They're just, so jagged or rigid. We don't want scars. We're going to want the plastic surgeon to come in so there's a nice clean fine scar, nothing too noticeable. The methods will be discussed, how the wound will be addressed. The meds pre-op that you're going to need is depending on the lacerations. Not all lacerations are going to be dealing with meds. Usually a local anesthesia is given, which just numbs the area that we're going to be stitching, staples, whatever is given. General anesthesia is usually given if there's more than one laceration and it's a considerable amount of stitching, staples is going to be needed due to car accidents, fights. There is domestic violence that comes through here, so we're probably going to have some general anesthesia be given. Instruments and supplies that you're going to be wanting, you're going to want sterile water, hemostats, syringe, gauze, different needles of different sizes. You never know if you're going to use the stitches or if you're going to need staples. You'll want a drape sheet, scissors, forceps, towel, and a wrap. You're going to want to clean the wound. You're going to want to use sterile water, irrigate it, pull out any of the debris, any of that's inside it. You get the car accident victims that come through. There's going to be glass, anything in it. You want to get all that out before you close the laceration, or there's going to be more prone to infection. You're going to feel the glass coming up through the skin. You don't want any of that. Mild soap may be used if the cut is deep. Again, you want to get all the debris out. You don't want anything left inside that cut. Will cause infection. Jagged edges may be cut away. You want all the rough skin taken away. You want a smooth surface. You want a clean canvas to work with. Anything better for you to work with, you want. The damage and dead tissue, you want that removed because it will prevent infection. If you get some dead, decayed skin underneath, it's going to cause the infection to seep and you're going to have problems with the incision site. After all this has been done, the doctor is going to use one of the following methods to close the wound. He's either going to use dermabond, steri strips, sutures, staples, or hair tying. Hair tying is used at certain events where if you've got a head wound, you're just going to take the hair, pull it back. Sometimes it's in a ponytail or it's even glued into place to hold the wound shut. It's not too common that we've heard of, but mostly in here we're going to use our sutures and our staples. Dermabond used, good for the face. Your post-op, you're going to give your pain meds and your antibiotics to your patient. You don't want them to go home in a lot of pain. You don't want them to go home and get an infection. So you always want to make sure that they got their antibiotics that the doctor prescribes. Some of our patients will have a possible blood test done if they come in with a dog bite or it's really, really dirty. Make sure that they don't have anything going through their blood system that could cause an infection later. You're going to want a possible tetanus booster. If they have not had their booster within the past 5 years or did not have their shots updated within 3 series, you're going to want to offer that. It will be good. Their home care, you're just going to want to instruct them. Keep the area clean and dry. You don't want to get anything in there because it's going to cause infection. You can shower in 24 to 48 hours depending on the type of incision, type of cut, type of dressing you have. You're going to want to take pain medicine as ordered. Do not let your pain get out of control. It is hard to monitor once you let it get out of control because you're going to want to up your dosage. You're going to want to take more doses than needed. Keep your pain meds as ordered. You want to avoid strenuous activity. You don't want to have them pull their staples, their sutures, because they're going to be right back in here. Oh, what happened? Oh, well, it was, make sure you stress. No strenuous activity. Keep it on the down low for the next couple days. Rest, take, your time with anything. Depending on the laceration and the type of, equipment we use to install anything, you're going to want to make sure that they know how to apply dressings. You might get something that's a little bit more severe than a regular, oh, I fell down the stairs, cut myself. You're going to want to make sure that they know to cover their dressings if it needs to be. If it needs to have a dressing applied every couple hours, if it seeps blood, a little bit of drainage. This is normal with some new wounds that they are going to seep a little bit. You're going to want to return in X amount of days to have the sutures or staples removed. Depending on where you get your staples or stitches put in is when you're going to come. Usually for the face, they recommend anywhere from 4 to 7 days depending on how bad the laceration is. If you leave the stitches in way too long, when it heals, you're going to see the stitch marks. You don't want that on a face. You don't want that anywhere that's purely visible. Some people just don't want a scar in general. Make sure you stress these habits. Okay, a few other things that aren't listed on here that's just general knowledge. Tell them to stay out of the sun, usually for that area for about 6 months because their scars are going to tan faster than the regular skin and it's going to, be a darker tan line. If they don't want this, tell them to use a lot of sunblock, try to avoid that situations. Your post-op meds is acetaminophen, ibuprofen, ketaphen, naproxen, narcotic pain medicine. This is where we're getting into this touchy situations. You're going to want to give pain medicine as needed. You don't want to overly prescribe something. You don't want to keep giving strong pain medicines if it's not needed. Okay, if they come in with multiple lacerations where they're in surgery and yeah, we're going to send them home with a stronger pain medication. It's just in general to keep their pain level under control. Okay, if somebody just comes in with a small laceration, send them home with some Tylenol. Don't give them the strong stuff. Use common sense. Do what you would prescribe, what you would feel you would want. When you're going to want to stress to them when to call the doctor. You're going to want to call the doctor if they have any jagged or gaping edges. Purulent drainage. This is like nasty infection color drainage, yellowish to green. That's not normal. You want them to call us. You're going to want a fever greater than 100 to be reported. This is a start of an infection. We need to catch it. Okay, if there's red streaks near the wound, once again, we have an infection starting. Get in here. We need to nick it in the butt before it spreads up the arms, legs, wherever. If your sutures are coming out on their own or too early, this could be a problem. Because if it's not healed properly, they're going to have problems with their tissues healing properly. They can have complications later down the road. You want to make sure that your sutures are in proper placing where they're not going to come out early, During repaired lacerations, there's usually 11 million visits to the ER a year. That's a lot of patients we're dealing with in and out. Okay, and probably a good portion of them, they're not done properly, and we re-see in here for infections. People don't report their infection starting. They come in later with streaks up their arm, blood poisoning, infections. What happens? They're admitted to the hospital then. We don't want to see this. We want us to nick it right here, right now. If we know how to take care of a laceration, we can get our patients in and out and have them in a safe environment. Okay, here we got just a simple needle that's used for anesthesia that will be inserted into the wound when anesthesia is given if it is needed. Okay, here's a needle and thread for sutures. The needles are not normal for sutures. Usually you see your mom out there knit with a straight needle. We don't do that here. We use the curved needle to go in under the skin to pull it up clearly, cleanly, tie our knots. You're going to want to leave 1/8 of a thread at the end of your knot to make sure that there is room for expansion, and so it's not too irritating for the patient, and when the sutures are to be able to be removed, that it is removed easily. And that's going to conclude our just retouch up of repair of a laceration. If there's any questions, concerns, or anything, please voice them at the end. If you need to stay back and talk to me or one of the other colleagues, doctors, feel free to do so. If you do not understand something, get it clarified, please. We want to get our patients in and out in a safely manner. Thank you.